Hi everyone, welcome to today's episode of Pregnancy Gang. I have a question here today from a patient. She says, I'm pregnant with a smaller baby. Why is that? What extra precautions I should take? Many thanks for this question. Very important. You'll be surprised to know that in single pregnancies, as many as 6% mothers have smaller babies. 2% of them have it much earlier, what we call as early onset fetal growth restriction, and remaining would have a late onset, meaning beyond 34 weeks fetal growth restriction. Why do people have fetal growth restriction is a very complex issue, and doctors are still trying to understand it. There are more than 20 factors which have been mentioned and are known to cause growth restriction. Environmental factors like polluted air, smoking can cause these issues. Also, factors such as first pregnancy, mother's pre-pregnancy fruit intake of less than 5 per day, mothers with low BMI below 19, BMI above 25, especially above 30, are considered to be at higher risk of growth restriction. You'll be surprised to know even your birth weight at the time of delivery when you were born matters a lot. So does your partner's birth weight. And then there are other conditions like high blood pressure, autoimmune diseases, diseases like thrombophilias, which are also known to cause growth restriction in the baby. But in spite of all this, vast majority of these babies may be small but not growth restricted. And again, some rarer conditions like genetic problems, infection in the womb can also cause pathologically fetal growth restriction. This is especially true when it is early onset growth restriction. How should you manage these pregnancies is at a specialty clinic on fetal growth restriction, where your obstetrician, fetal medicine specialist, geneticist, and neonatologist all work together. These specialty clinics are better equipped to look after growth restricted babies with advanced sonography machines, scanning techniques, expertise by the manpower, and softwares including artificial intelligence. Make sure that you understand this better and make use of this modern technology. Are there any medications to reduce growth restriction? Sadly, the answer is no. Although scientists have been working on developing such medications, none of the medications, including protein supplements, amino acid supplements, amino acid injections, have shown to make any difference. What we strongly recommend is healthy lifestyle, not putting on too much weight, avoiding protein supplements, however, taking the protein through diet. Exercise helps improve the blood supply, so moderate exercise, not excessive, not less, is important for babies' healthy growth and mother's health. Not all growth restricted babies require a cesarean delivery either. We'll talk about delivery decisions in these babies in our another episode of fetal growth restriction. Stay tuned for more. For any questions, feel free to ask in our comment box. Thank you so much.